All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions that we've received through today, the 31st of August. And we invite you to continue to submit your questions through us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion today is Vinay Durbakula, who's an intern this summer with the Institute. So Vinay, I now turn it over to you.
Thanks, Kristen. So today we'll start like every other day by updating some statistics on Illinois. So the current trajectory in terms of vaccinations continues to see a gradual increase, with Illinois, as of today, being 50.6% vaccinated, which has shown an increase about 0.4%. So a slow increase, but still an increase nonetheless. Then we look at positivity rate per day. Now, Illinois has seen another gradual increase in the number of positive cases per day, clocking the highest number since early January. However, the positivity rate per day remains at 3,620. While this may seem higher than it was before, looking to states like Florida, which see 22,870 cases per day, and Texas with 15,313 per day, again, Illinois compares very well to these states. And so in terms of COVID actual cases in the state, Illinois is doing fairly well. In terms of major headlines, the biggest things are just the state of the country as we progress into the fall. Obviously, academic calendars begin, schools start opening up. And so again, around the country, we're seeing more and more cases rise. And with that in mind, the European Union has actually come out and said they're planning on banning US travel, non-essential US travel into their respective countries because of the increase in COVID in the country. In addition, hospitals in parts of the South continue to run dry of oxygen. And so while the bed space was waning last week, now we start to see oxygen start to wane. And so again, we're kind of reverting back into that path where we're seeing less and less hospital capacity because of the increase in the number of cases. But then Dr. Murphy, I turn it over to you. The state of the country in terms of as academic calendars start, what do you have to say about that?
Well, Illinois, just how we start every time, Illinois doing reasonably well. It's still bad, but it's doing reasonably well compared to other states where they are not doing the full court press and getting this thing under control. Vaccines are a major part of it, but so is our mask guidelines and social distancing and banning large groups of people like we did early on in the pandemic. We have to use everything at our disposal at this particular point to get over this fourth wave. Regarding the Europeans banning, it's really actually a guidance. It is non-binding. The individual states in the European Union can do whatever they want. However, they've put the United States kind of on the blacklist of travelers, and some of those countries are going to not allow Americans into their country now, unless there's some kind of essential business that they have to do. So that's a bad marker, but we are out of control here, and we're the #1 country again, for COVID cases. So their action is not really unreasonable.
Yeah, and then it's been when Governor Pritzker announced the mask mandate. I guess the mask mandate did start yesterday, actually, Monday, in accordance with that public school opening. And so do you foresee any other mandates coming in the future, or is Chicago or Illinois as a state doing very well in terms of announcing these mandates?
I think we're going to see an avalanche of mandates. I think we're going to see some personal challenges to those mandates. There are organized groups going against it. However, the courts have upheld the mandates. Even in Florida, the governor cannot ban all those mask mandates. It's because it's putting so many people at risk. So you're going to see more and more mandates. You're going to see more and more people dismissed from their jobs or their positions if they don't get vaccinated or have a real excuse. One other alternative is they get frequently tested, whether that's once a week or twice a week, basically how we were doing in the universities last school year. So all that put together, every time we put those kind of rules in place, those guidelines, the waves have come down. So, I think we're doing everything that we can, and I think you're going to see this wave go away soon.
That's amazing news. We look forward to that happening, hopefully. Then we'll move on to the viewer-based questions part of the show. And so we'll start. Several people are just concerned with the idea of reinfection. And so a lot of people are vaccinated. A lot of people have quote unquote antibodies, so they say. So what exactly happens when you do test positive? Do you get antibodies? And then in terms of reinfection, what is the status in terms of vaccinations?
Yeah. So, after you are exposed to a virus, you develop antibodies, and some of them are protective. However, depending on the viral load that you were exposed to and how severe your disease was, actually has a big determination into how many antibodies you actually have. So if you have kind of a mild disease, or almost no symptoms, you may have very few antibodies, and they may actually go completely away. If you had a kind of a severe disease, had many symptoms, maybe you have a very high antibody level. But we know that reinfections occur after you have COVID. We started seeing them about 3 months after the first cases of COVID out there. So just having COVID in the past is not enough. The other point here, Vinay, is that the antibodies that you can commercially get today in the world actually are antibodies that were developed to detect COVID as a diagnosis, that you had the infection. Right. It's not the same antibody exactly as that you develop after you take the vaccine. Got it. So they're not the same thing. And so going and measuring a commercial antibody basically does not help you. You're wasting your time. Now, it would be a great thing if we had a test that could determine immunity to COVID. And many labs are working on such a thing, but it doesn't exist today. Mm-hmm. So the best thing we can do is just follow the public health guidelines and take the vaccines when they advise you to take them. And whether you had COVID or you didn't have COVID, and just do it, because that will protect you. And we know the safety now, after over billions of doses have been given out worldwide and hundreds of millions here in the United States, we know it's safe.
Mm-hmm. And then I guess building off of that, in terms of the booster, which was announced fairly recently, people are concerned still about whether or not they actually need it. Some people are saying that, well, their body was really healthy after COVID. They don't necessarily believe that they need it. And so what do you have to say about, in terms of the booster, is it necessary for everyone to be getting?
It is absolutely necessary for everybody to take the booster. There is nothing unusual about booster shots. Look what you do with the flu every year. You get a different flu shot every year. With the pneumonia vaccine, there are different schemas for that, but there's boosters for everything. So it's just not unusual. This is to be expected. Granted, it is a pandemic. We don't know the optimal schedule. We don't know if you could take a lower dose for the booster. Sometimes that is just as effective. There's a lot of things we don't know. They're studying now, but these are things that we'll sort out later. But in the interim, you don't want to get sick. Right. You don't want to get severely ill. You don't want to end up in the hospital. You don't want to die from this thing. That is preventable. You look at the hospital wards now, over 90% of the patients are unvaccinated. That is what's driving the pandemic. We don't want to do that.
That makes sense. And then obviously there are people out there who are unvaccinated. And so gatherings that involve vaccinated and unvaccinated people can be concerns for some people. And so several people were wondering, if someone is unvaccinated, but they had tested positive, you mentioned that they do need the vaccine, but if they don't have the vaccine, should those who are vaccinated feel uncomfortable around them?
No, the mixing of vaccinated and unvaccinated people, it should not be done. And that's what these mandates are going to do. businesses and institutions are going to mandate vaccines for everyone, even for international travel as well. These other countries don't want you if you're not vaccinated. If you prefer, you could stay in your country. But what's going to happen is you're going to have to stay like in a smaller and smaller place because these mandates are going to come into play, and that it's happening every day. That the places that haven't mandated, they're putting the vaccinated and unvaccinated together, and that puts those unvaccinated people at significant risk. And then the unvaccinated people are even at bigger risk to get really, really sick. And then you have all these people quarantined, and you can't do your job. It's very difficult to operate any kind of business or office or whatever if you keep having people dropping out, because they're in quarantine, which is now the recommendation whether you're vaccinated or not. So this is just going to be more and more of that. You shouldn't be mixing vaccinated and unvaccinated people. In France, you have to be vaccinated even to get inside in a restaurant.
Wow.
You can eat outside if you're not vaccinated, but you can't go inside.
Yeah. And then building off of that, so several people were, with school starting, wondering if they should be enrolling their kids in schools where there is kind of some unsure aspects of whether or not people are vaccinated, like the teachers and stuff. I don't think some preschools are announcing whether or not they are. And so they were just kind of wondering, should they be sending their kids to these schools that aren't telling whether or not their staff is vaccinated?
It's not safe. Now, Illinois has mandated all teachers and staff at schools and healthcare facilities have to be vaccinated. So it's a state mandate. And that's coming into place as we speak. I believe the deadline are the end of October, but it is not safe to send your kid to school if the staff is not completely vaccinated.
So then with this new COVID vaccine, several people are wondering, combining vaccines, is there an issue with it? Specifically, people are asking about the pneumonia vaccination, and they're kind of just wondering, are there certain side effects or are there certain defects that come when someone takes a pneumonia vaccine and then gets a COVID booster? Or is there maybe a particular order that should be employed when you're scheduled for both vaccines at the same time?
In the vast majority of cases, the guidance for this approach changed in August. I think it was August 9th, that you can take all the vaccines all at the same time. The side effects will overlap, and you can have very significant side effects to the pneumonia vaccine or a flu vaccine or the COVID vaccine. However, now there's no limitation because the point is, every time you make it more complicated to take the vaccines, you have dropouts along the way. They don't come back for the second one or whatever. So from a public health standpoint, if it's easier just to take them all at once, take them all at once.
Got it.
Oh, the other thing about the pneumonia vaccine, I don't know if you were going to bring it up next, but there's some suggestion from the Kaiser Permanente group that people that got one of the pneumonia vaccines actually tended to do better, get less disease with COVID than the people that didn't get the pneumonia vaccine, even though they'd had the COVID vaccine. So that was such an interesting finding that they're actually doing a study in people 65 and over, giving the pneumonia vaccine along with the COVID booster or not. Very fascinating. You may remember early in the pandemic that there was some legitimate real data on the measles vaccine, and that there were fewer cases in people who had recently gotten measles vaccine. So what's happening here is that these other vaccines may actually be beneficial in terms of kind of a broad array of infections, in that they're stimulating the immune system so much that you're getting this kind of non-specific benefit as well as the specific antibody protection and T-cell protection that you get from the actual vaccine. So it's really a fascinating study, and I think and people are going ahead and doing this, and this data is very very exciting.
So I'm honestly personally curious, is this newer data in terms of, obviously with the COVID vaccine it is, but in terms of just in general, do vaccines tend to generate kind of this broad immune
Yeah,
response?
no, this is well known.
Okay.
I mean, it's not 100% protective or anything, but it
Right,
does
of course.
give you a little bit of a leg up. Mhm.
And then the next question is, in terms of family gatherings that have everyone vaccinated and small numbers, would you say that if everyone is vaccinated and they're gathering in fairly smaller numbers in the status quo, is that pretty safe for
Yeah,
most
I don't
people?
think, what the guidance says, if everybody's vaccinated, everybody knows each other and everybody's asymptomatic, that, you can have safe gatherings. And it's basically crowd size, where these people are coming from. Also, if it was somebody coming from Florida, you may think a little twice. The other thing that may change your mind is if somebody in the group is immunocompromised, they have a chronic leukemia or lymphoma or some other immunocompromised condition, they would be much more at risk. So, you have to take every situation in particular, but if everyone is generally healthy, it should be okay. And we don't want to really discourage that. It's relatively safe.
And then, I mean, aside from masking, is there any other precautions that they could take? Maybe like a filter or something to install in the house?
There's a lot of talk about filters. So, they use them on airplanes. They use them in some buildings. It's not really recommended in general, but people can put HEPA filters on their HVAC units. I'm not recommending. No one is recommending that people run around and do it. The number one way this thing is spread is person to person.
Right.
Yes, it can aerosolize, and maybe those filters help, but it's not that dramatic, and there's no official guidance. It hasn't hit the point where people are saying everyone should be doing that filtering. So probably it's not necessary at this particular point. It's still the person-to-person transmission that we need to focus on.
Got it. And then our final question of the day just kind of ties back to the boosters. There's a lot of ambiguity in terms of when the booster should be taken and if there is like a set timeline in terms of when they should be taken. And so I'm just curious, is there a certain way that boosters should be taken, certain point, or is it kind of just a pretty flexible timeline in a certain range of months?
Well, we're in the middle of this pandemic mess. We don't know the optimal schedule to give these vaccines because the whole process is just so dynamic.
Right.
And in the last 4 to 6 weeks, we've had 4 different recommendations about these boosters. First of all, everybody agrees that we're going to need a booster. But then what we don't agree on is when we give that booster. And a lot of focus is put on these neutralizing antibodies that have been measured in basically research or industrial labs, not the commercial ones that you just buy out there.
Right.
So I think it was 4 or 6 weeks ago, you had the CEO of Pfizer saying, everybody needs a booster. And a lot of this was backed up by data in Israel. There's been people that have criticized that Israeli study, but still all of a sudden people were getting breakthrough infections. And the CEO said that, and then there was immediate pushback from the CDC and the NIH saying, hey, where's the real data here? And so everybody quieted down about the fact that we don't know when the booster is and don't go running out and getting a booster. Then all of a sudden, you had from our lead institutions, oh yeah, it looks like these antibodies are going down over time and you need a booster at 8 months. And then about a week later, all of a sudden it was, oh, by the way, I think you need a booster at 6 months. And then 2 days ago, I said, well, no, maybe 8 months. Okay, so I don't know. Nobody knows when, but you need a booster. And the question is when. And there's probably not like a absolute, like you don't just drop off your antibody levels just don't crash.
Right.
They're just kind of drifting downward. You still have a lot of other T cell protection. That's not an antibody measure, but that test is so complicated and expensive and difficult to do. It's not going to happen. We're looking for other tests to look at that. But so right now, I think the last thing I heard was it's 8 months, but we're flexible. It's like you want to get it at, I don't know, 6 months, or I even heard one thing, 5 months. So, but anyway, you need a booster, and the question is when, and it looks like it's around 8 months, and people should get it. It's not approved yet as a booster. It is approved if you're immunocompromised. You can get, they call that a third dose, not really a booster. So if you have an immunocompromised condition, you're on steroids, or you have an organ transplant or something, go ahead and get the shot now. Otherwise, the change in the emergency use authorization is coming in the next week or two. And, they must be sitting there deciding, is it 6 months or 8 months? We don't know. When that comes out, the guidance comes out, then those people that got vaccinated in December and January would be up first. A lot of those are nursing home residents and people in residential facilities and healthcare workers. Those were the first batch of people like myself that got vaccinated. And if it's 8 months, it's great because that fits in right as the vaccine rollout. So we'll have like a secondary rollout in these vaccines. A lot of people are just doing it on their own. They're just walking into a pharmacy or something and just getting another shot. But the official recommendation and permission will be shortly, like a week or two.
Got it. Awesome. Well, that's all we have for today. Thank you so much, Dr. Murphy, for your help.
Thank you, Vinay.